we'll see the appropriateness of the patient selection. Suppose some patient comes from the emergency or some place, then we check that patient's heart rate is very low, bradycardia with hemodynamic instability, and I want to go for pacing. I'm not having transvenous pacing as of now, then I have to consider for transcutaneous pacing. For that, I'll apply the pads appropriately like this, and I'll make sure that the connections, it is well connected to my machine, right? These connections are appropriate. Then I'll switch on my machine like okay, and I'll go to the pacer mode. So this is, you can see, this is the pacer. So I'll switch on. This is my pacer mode. Then I can select mode like this, whether I want to go for fixed mode or I want to go for demand mode. What does it mean, demand mode? Demand means I'll look for the capture, increasing this my output. So suppose I'll increase it to maximum, like this is maximum. I'll start, then I'll check for the capture. I'll confirm with the help of seeing the traces and pulse of my patient and blood pressures. So then I'll reduce this output like this. I'll reduce it, and my machine will give as per demand of the patient, as per requirement of the patient. Another mode is I'll go for, suppose this is a fixed mode. So this pacer will keep on pacing as per my targets. Like suppose I set the rate is like my rate I set 100, then at 100 it will keep on with the, and my output is like suppose I set at 60. So on 60 and 100 it will keep on pacing. So these are the two modes. So as we confirm once again, the checking the circuits, checking the this pads, and we have fixed output, we have fixed rate as per demand mode or as per our demand mode and the fixed mode. The pacing will keep on happening. So this is the way, and make sure that you are checking your patient every time. So you are checking pulse, you are checking blood pressures, hemodynamic instability, that also, and that is in terms of that we will check the response of the patient. So, and ultimately we may need to switch to intravenous pacing or permanent pacing depending upon the patient's condition. I think this is all about the cutaneous pacing. If there is anything, you can ask questions related to it. Thank you.